Hi, good evening everyone. Hope everyone can hear me okay. It's really nice to have everyone here. We've got lots of people logged in, so hopefully it should be a good and informative event for you. So my name's Amy Barry. I'm the head of laboratories for the CARE group in the UK. And I'll be joined later by Professor Charles Kingsland, who's our Group Medical Director. We're here to answer all of your questions and hopefully give you lots of information about what it means to have fertility treatment with CARE. So the event will be organised into a few parts. So we'll have a few videos with the bits of information on. I'm going to go through a presentation which will take you all the way from diagnosing the fertility problem through to treatment, lab processes and techniques that we can provide to help improve chances of success. I'll talk a bit about support at CARE and funding that's available through CARE funding packages, getting started, so how you'd go about making the first step, and then we're going to have 2 Q&A segments as well. So we'll break those up with a short video just to give you a bit of time to think of any leftover questions that you feel haven't quite been answered. So asking questions, we've got a whole team behind this, lots of people ready in the wings waiting to answer your questions. So you can either put a question in the chat function. If you do that, then everyone will be able to see your name. So if you would rather everyone didn't see, then you can put it in the questions tab. You can also email us at events@carefertility.com, or you can give us a ring. So we've got a team here until 8 o'clock. Ready to answer any questions that you might have about any parts of the treatment and give you a bit of a feel for what it's like to have treatment at CARE. If we don't have time to answer all of your questions, hopefully we will, but if we don't, then we'll try and answer them after the event via email. Okay, so I'm going to kick things off and we're going to start with a short video just to give you a bit of an introduction into CARE.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are CARE.
My name is Professor Charles Kingsland and I'm the Group Clinical Director for CARE Fertility. At CARE, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us, so we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic, and even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Okay, so I'm just going to open up the presentation and we'll get started with that. Okay, so obviously we said it in the video, and I'd reiterate that message that we do believe at Care that family is for everyone, and one of the ways that we like to make our treatments accessible to everyone is by having clinics as far across the UK as we can, to make journeys easy for our patients. So here's just a quick roadmap just showing you where our clinics are. We've got main clinics that are bolder in purple, and then we've got smaller satellite clinics dotted around where you can have lots of different parts of your treatment to help make the journey easier for you. So we do treat lots of different types of patients, heterosexual couples, same-sex couples, single patients, patients looking for using donor gametes, donor sperm and eggs, and those patients undergoing fertility preservation. So there have already been some questions come through about are we going to discuss donor eggs and the process for that, and we will touch on that certainly, and we can cover that a bit in the Q&A as well. But during this presentation I'm going to mainly focus on the process from a very basic IVF standpoint. It will be the majority will be applicable to you, but there will be slight differences depending on the treatment that is right for you guys. So the first step to starting your journey with Care is obviously to get in touch. So this is our general inquiries team manager, Shah, and it's really easy to get in touch with us and make the start. I mean, you're already here tonight listening to this, so that's one step. You can just give us a call on the number that has been posted in the chat. We're there till 8 o'clock tonight, or you can give us a call tomorrow or whenever you feel comfortable, and you can always email us as well, or email your local clinic, get in touch with your local clinic. We've got the big events team behind this who are there to support you as well, if you have any, if you want to know any more about how to get in touch in the first instance. So the first step to the journey really is to get the right diagnosis, and some of you might be at the very beginning of the journey and you haven't had any tests yet. Some of you might be partway through, you've had some tests but not all, and some of you might be, you've already had treatment elsewhere and you're coming to Care for subsequent treatment. So regardless of the stage of the journey that you're at, we obviously want to review any test results that you have already, or get you the right tests that we think you need to help inform treatment type is going to be best for you. So we take the time to get to know everything about you, anything that you already have we want to see. So we have a secure online patient portal where we would ask you to upload all of the relevant documentation that you might already have from previous tests or treatments. and we'll review all of that information before any appointment with us. It's all in one place, it's all confidential, all secure, and it's also two-way. So you can upload things to us and we can also send things to you, like your treatment protocol, your consent forms, videos of developing embryos. So the patient portal is a really good start. You'll get a detailed medical questionnaire on the patient portal as well. That'll ask you lots of questions about any test that you've already have. And as I said, it'll all be reviewed prior to your consultation. So the portal can be accessed multiple ways: desktop, laptop, mobile or tablet. It's supposed to make things really easy for you, so it can be accessed on lots of platforms. So this is George, one of our consultants. So during a consultation, we will take the time to get to know what it is that you want to achieve. Obviously, we all know what the end game is, but what are your wishes and your plans? Is it one baby, or would you like a family? We'll look at all of your test results and explain if you need, if and why you might need any further tests. We discuss all of the different treatment options that will be relevant to you. Not all of the things that we offer will be relevant, but we will, based on your history and your test results, discuss any treatment options that we think would help. And we'll give you detailed information about these treatment options so that you can go away and consider them in your own time, and let us know if you wanted to go with any of them or not. We'll talk to you about support, going through the different ways that you can get support during your journey at care. And we'll talk about costs as well, another important factor. We'll give you all the time that you need to ask questions, and it's great for you to come prepared to that consultation, to know what you want to get out of it, have a list of questions ready. So whether the problem is more complex or whether it's simple, you will get across all of the care clinics a real depth of experience from the consultants to be able to plan your treatment, the most effective treatment for you. So once we've decided what treatment is best for you, generally speaking, you would undergo a round of ovarian stimulation monitoring, and then we'd collect the eggs and collect the sperm and put the two together and hope for fertilization. So you may not need IVF. You may wish to try something a little simpler to begin with. That will depend on your history and your test results, but you might try something like an IUI instead, intrauterine insemination. Either way, most care patients would need some form of IVF, where we would undergo ovarian stimulation. So I'm just going to go into that in a little bit more detail. So we'll prescribe some medication that will stimulate the ovaries to produce, hopefully, multiple eggs. The medication protocol will be explained to you by the nursing team, and we'll also tell you how to administer those drugs. And you can see Diane here, one of our nursing team, just showing some of the medication and how to administer them in a video that would be available to you during your treatment. So once you've started the medication, we would monitor how your ovaries are responding. So we want to check that the follicles are growing, and each follicle ideally would have one egg inside. Some have none, but we're hoping for a good number of follicles to develop in response to the medication that you've been prescribed. So the monitoring phase is usually about a week. You'll be on that stimulation medication for anywhere between kind of 8 and 12 days. It will depend on your response, your history and your test results. Once we think that you've got a good number of follicles growing and they're at the right size, we'll give you what's called the final trigger injection. And that injection will take place 36 hours before your egg collection procedure. And that's the final maturation trigger injection that we would prescribe. So you've had the trigger injection. We think that you're ready to come for the egg collection 36 hours later. So here's just a bit of a diagram about the egg collection procedure. So it's relatively straightforward, 20 minutes to half an hour maximum, and we would pass a needle through the vaginal wall into the ovaries and aspirate or suck or remove the fluid from the ovaries that would hopefully have an egg inside. Obviously, that fluid would be passed through to the lab team, and they'll have a look through that fluid to make sure that we're getting the eggs that we need. Once the egg collection has finished, you can recover in our recovery areas in the clinics, and you should be able to go home relatively soon afterwards. So we've got the eggs. We obviously then need the sperm, and there will be differences in the different types of sperm that would be used. Some of you might be using frozen sperm, some of you might be using testicular sperm, some of you may be using donor sperm. But as a general, we'd obviously have the sample collected from the partner, and then we want to prepare the sample ready for either the IVF or the ICSI procedure. So the sperm would be collected on the same day as the egg collection. Very simply, it would likely be a drop-off, so you'd be provided with a pot to produce your sample at home, and then drop the sample off with us at the same time as you come in for the egg collection. So I have a short video showing you a new technology that we have that's called computer-aided semen analysis. So you can see here the sperm swimming around on the screen. So this is a bit of technology that tracks each sperm in the sample and tells us how well they're moving, how fast, whether they look normal, and can help us inform which treatment type would be best for you. So just back to the presentation. So the process for achieving fertilization mentioned IVF and ICSI. IVF is used as kind of a general term for people undergoing fertility treatment, but in the lab we use IVF to indicate the type of insemination method that we would use to hopefully achieve fertilization. So IVF would be performed for those who have a sperm sample that has got a good number of sperm. They are moving in the right direction and they look good, they look normal. We would simply prepare the sperm sample, make sure that it's clean, and then put the sperm in with the eggs, leave them overnight, and then check them the next day for fertilization. ICSI is slightly different. That's used for patients who have potentially got a lower number of sperm in their sample. The sperm maybe aren't moving in the right direction or moving as quickly as we'd like, or perhaps they don't look as normal as we'd like them to. So what we need to do in those cases is have a look on a higher magnification microscope and select a single sperm for each individual egg that we would then manually inject into each egg. So I've got a video of the ICSI procedure to show you. So you'll see an egg in the center being held in place, and then the needle on the right hand side, you can see a little sperm moving down. We'll push the needle into the egg gently, aspirate a little bit of the inner of the egg just to break the membrane to make sure the sperm definitely go inside. Deposit the sperm in the center and then remove the needle gently from the egg. So we would do that for all of the mature eggs that were collected. Not all of the eggs that are collected would be mature potentially, usually about 80%, but that's what we would expect. So we then look for fertilization the next day, about 16 to 18 hours after we performed either the IVF or the ICSI, and we'd get in touch with you and we'd let you know how many of the eggs had fertilized, and therefore how many embryos you had. And then we obviously want to grow the embryos and see how they develop. So this is Alex, our lab manager from London, and she's just looking at a bit of equipment we have called embryoscope. And the embryoscope has got a camera inside that takes an image of each of your embryos every 10 minutes. And we end up with a movie of the embryo development over the course of its time with us in the lab, which is about 5 to 6 days. And this video is really helpful for us to select which embryo we think is the best one out of the group that's going to give you the highest chance of a pregnancy. So there's some images here in the bottom corner of this screen. The first image on the left-hand top left, that's a fertilized egg. So we can tell there's 2 circles in the middle of the egg, and that shows fertilized. The next image over at 45 hours at the top right-hand side, that's where the embryo would be about day 2. And then the bottom left would be day 3. It's got around 8 cells at that point. And then by day 5, the bottom right-hand side, that's a blastocyst. And that's where the embryo has got hundreds of cells. We can't count the cells anymore, but we can see that it has started to expand. It's started to grow, and it's what we would call a day 5 blastocyst embryo. So there's lots of technologies that we have available to us at Care that we think can maximise your chances of success. And in your consultation, we would talk to you about these technologies and let you know if we thought that they would be helpful for you. So the first one that we have that we're very proud of is CareMap. And this is a bit of software that analyses the images produced by the embryoscope, and it tells us which embryo is the best out of a cohort. And it does this by tracking exactly when the cells divide, and it's all based on the timings and if the cells are dividing at the right times. And we'd end up with a score of each embryo from 1 to 10, 10 being the best, 1 being the worst. And we'd be able to tell you, depending on the score, what your chance of having a baby from that embryo would be. We'd be able to give you a percentage chance based on that score. So we also do Pgta, pre-implantation genetic testing. There's lots of clinics that perform this. And this is where we would remove 5 to 6 cells of a blastocyst, day 5 or day 6 embryo. And we'd send those cells off for testing to tell us whether those cells have got the right number of chromosomes in or not. And the result of this is tells us if the embryo as a whole is what we would call chromosomally normal. And if it is, then we would go ahead and we would transfer the embryo at a later date. The embryo would need to be frozen whilst the genetic results were returned for the cells that we sent away. If the embryo was abnormal, then we would have that information that the embryo was unlikely to create a pregnancy or not even an ongoing pregnancy. So we also have some other diagnostic tests. We've got Care Unity, we've got the SOS test, we do genetic and reproductive health tests. There's lots of things that we can offer, and we'll be able to talk to you in more detail about all of that at a consultation. So I've got a video just to show you of an embryo developing, because it's always interesting. So this starts at about the day 3 phase stage, and you can see that it's coming together. We can't see the cells anymore, and then it starts to expand and get bigger and create the blastocyst that we would like to see on day 5. And we start to see a mass of cells forming at around 4 o'clock. That's what we would call the inner cell mass. That's the bit that would go on to become the baby. And it's flipped around just at about 2 o'clock now. And it's really important that we can see those different cell types. That tells us how well that embryo is doing. And you would also be provided with a video of any embryo that we transfer for you. And that would go directly onto your portal. So we've put the eggs and sperm together, we've grown the embryos, and now we've selected the best embryo using whichever technology is available to us. And now we want to put the embryo back. So we would perform the embryo transfer for you. So it's a very straightforward procedure. It's mostly done under ultrasound guidance so that we can see that we're putting the embryo back in the right place in the uterus. It's 15 minutes, 15-20 minutes. You're not sedated, you're not asleep. It's very like a smear test. And you can just go about your normal day afterwards. We don't ask you to lie down for 2 weeks or anything like that. We just say, take it easy, rest if you prefer. And then it would be the 2-week wait. So this is one of the hardest parts, is the waiting to do the pregnancy test after you've had your embryo transferred. We'll obviously tell you what you should and shouldn't be doing in that 2 weeks. And we'd give you some medication to support the lining of the womb to make sure that the environment was optimal for the embryo. Once you've performed the pregnancy test, we'd obviously ask you to get in touch with us and let us know the result. Either way, if it's positive, great, we'll get you booked in for a scan 4 to 5 weeks later to check if there's a heartbeat. If it's negative, we'd obviously have all of the support that you would need to help you through that. And there's free counselling available at any point as well. Once you've had the scan, it would be a discharge to your GP, and then we'd just ask to hear the outcome. Love to see baby pictures in 9 months afterwards. So that's kind of the IVF process in a nutshell. There will be differences, slight differences. For example, some people who would be using donor sperm or donor eggs. So we have got one of the biggest donor egg banks available. We've got over 25 years experience within our donation teams at Care, and we've helped more people start a family with the help of a donor than any other clinic in the UK. So we really support you through the entire process, right from the very beginning at consultation, where you decide you need to use donor eggs or donor sperm, all the way through to selecting your donor, getting the donor sperm on site from another clinic, or the donor eggs indeed from another clinic, and then all the way through treatment as we would with anyone else. We have specialist counselling for patients using donor eggs and donor sperm. It's really important that all of the possibilities are discussed with you in great detail. So we would offer that to you free of charge as well. The specifics of the egg bank, I think we'll talk about in the Q&A session a little bit more, in terms of waiting time and the process in a little bit more detail, but it is relatively straightforward. You would be registered as recipients. You would, if it was the egg bank, the donor egg bank that you were interested in, you'd then be given access to the bank to browse the donors. You'd pick a donor. The clinics would be informed. We'd get the eggs to the right place, and then we'd organise with you the production of the sperm sample so that we could create the embryos. So there is, I've said it multiple times, but there's tons of support at Care. Counselling is free. We've got a really good Care Buddy scheme where you'd be linked up with someone else going through fertility treatment at the same clinic or at the same stage, and you can kind of help each other through the process. We run regular support events, including online support groups. We did do lots more in-person meetups when we were allowed, but obviously with COVID, it's been a little bit tricky. We've got a 24/7 Care online forum, which is a great resource for information specifically about treatment at Care. And as always, you've got the support of your local clinic or any Care clinic will give you the support that you need. One of the ways that we think is really important to support patients is through funding. So obviously treatment funding is tricky and treatment can be expensive. So we've developed something called Care Pay, is a package program, basically exclusive for care patients, and it makes the funding of your treatment easier to manage. So we developed this based on feedback from some patients that it was tricky to have to go to an external third party to organise funding packages. So we brought it all in-house and tried to make the process a little bit more seamless for the patients. So all Care Pay packages, there's the three listed here. So IVF multi-cycle, IVF refund and donor egg IVF refund. They all include cycle monitoring, egg collection, all embryology procedures, embryo transfer, freezing and storage, unlimited embryo transfers, blastocyst culture and care maps, included as extra benefits to help give you the best chance of success. If you want more information on Care Pay, there's tons of information. You just need to get in touch with the team, either on the number, the email, or your local clinic, and we'll be able to give you some more information on that. Okay, so now it's the Q&A. So I'm really hoping that Professor Kingsland manages to make it online with us. We've had tons of questions coming through, I believe. And I have a list of questions ready. So we'll just wait for the professor. We'll just give him a couple of minutes. He is dialing in from elsewhere. Hello.
Oh, yeah, it worked.
Fabulous.
Dr. Barry, I've put my glasses on because your glasses make you look super intelligent, if a little scary. So I need to mimic that.
That's not my intention. Right, well, we better get cracking because we've got loads of questions and we're already over time. So
yeah, I've got loaded. Do you want me to start, Amy? And then you
go.
Just
yeah,
okay.
Yeah.
So we as always we've been inundated with questions, and I'll answer as many as I possibly can. But the ones that we can't answer, we'll answer later. You can email us in, or we'll get back to you. If I'm with a clinic who aren't open at the weekends, how is my protocol managed? Well, most clinics are open at the weekends, but those that aren't, we will have a dial-in number, or before the weekend comes, just ask one of the nurses, the nursing managers, or one of the doctors, if I have a question over the weekend, what do I do? And we will provide that information for you. So you should never feel alone, even if your clinic is not open over both days of the weekend. So you should have knowledge of access to get to whatever, to answer whatever questions you need. What do I do if I'm unsure or nervous about my medications? Just ask us. We don't want you to be nervous. We want to give you all the information you need to make you feel as in control as possible. So if you have any questions, no matter how silly or how many times you've asked them before, if you don't understand or feel unsure or nervous, just ask again. It's what we're here for, and we want to make you feel as though you can control what's happening to you. Age limits for IVF and IVF with donor eggs. Well, the success rates go down with IVF as you get older. There's no real hard and fast age limit, but really with your own eggs, I would be thinking very carefully as to going ahead if you're over 45, but your individual clinic will give you advice as to your potential success rates given your age and based on all the other factors that are important, like your AMH, your ultrasound scan, and those sort of things. So ask the question, and then we could give you the answer that's specific for you. But generally speaking, your eggs not over the age of 45. Donor eggs, we would stick to the age of the natural menopause, which is 50. It's unusual for us to go over 50. We treat everybody on their individual merits, but generally speaking, it's the 50 for donor eggs. Is there anywhere I can connect or speak with others through my journey? It's my first time, and I just know I'll have so many questions. Well, as I've said before, you can always ask at the clinic. We have our own websites, don't we, Amy? We have our own forums. We have our own buddy system, so that we would like you to feel confident that there is always somebody that you can talk to, whether they're going through the journey themselves or whether they've been through a similar treatment, or indeed members of staff at the clinic. And what you also have to remember is a lot of the staff in the clinic have actually had IVF themselves, and so they will have not only professional knowledge but also personal knowledge of that IVF journey, which can be quite stressful. It can be very stressful, and so support is essential. How long are you under care following a successful transfer? Forever. Well, we like you to keep in touch with us as long as you want. So the treatment officially ends with your scan when we confirm you have a viable pregnancy at 6 weeks gestation, but it doesn't end there. We want you to feed back to us. We want you to let us know how you're getting on throughout your journey. And don't forget that also the majority of the doctors who work in care are consultant gynecologists. Many of them work in the NHS as well, so they will not only have gynecological knowledge, but they'll also have obstetric and maternity knowledge, and they'll be able to advise you or support you. Obviously, you will have your own advice in your maternity unit when you're going through your pregnancy. But we like to know. In fact, I was at a graduation of one of our IVF babies, a university graduation. She's 21. I was invited to the graduation ceremony. So, you know, you're part of the family, and we like to know what you're doing, or you know, whenever. So don't feel that at the end of your journey you've got the positive pregnancy test, that's the end. Pop in and come and see us. We love to know what's happening to our patients and their offspring. I've had 2 miscarriages at 23 and 17 weeks with donor eggs. Tests from the first were normal, awaiting the second results. Is there anything more I should ask for? Well, again, the majority of doctors who work for care are consultant gynecologists. Many are still working in the NHS, so they can also provide you with the advice and support, as well as your local hospital. Generally speaking, at 23 weeks and 17 weeks, if you've miscarried, which is a terrible tragedy for you, often that can be associated with a maternal issue over and above a fetal issue. Fetal issues or baby issues tend to miscarry in the first trimester. Not always, but mostly. So over 12 weeks, there may be a maternal issue which needs to be investigated and probably treated. So again, we can help you. Don't feel afraid to ask about your miscarriage, which is often undervalued. The trauma that you can suffer with a miscarriage will be profound and needs to be managed. Not only that the grief, but also the management to prevent that miscarriage happening again in the future. So seek advice, and if there's anything that we can do over and above your local maternity hospital or your local gynecologist, just ask the question. Anything we should take in the run up to IVF during, and can I continue exercise? The answer to that is yes, you can continue exercising. In fact, I think you should. Don't go mad, but just also preparation for IVF. Prepare, it's an important event. It's a potential life-changing event. So you have to get into training. Try and get down to your best weight, good diet, lots of sleep, take your folic acid, vitamin D. You don't have to take lots and lots of vitamins and minerals. If you've got a good diet, that should suffice. Folic acid, vitamin D, good diet, lots of sleep, exercise, fresh air, and that should do the trick. Test for unexplained infertility. Well, there are lots of tests, but essentially there are 3 major tests. Have I got eggs in my ovaries? are all my bits in the right place? An ultrasound scan, 2 of everything down the side, 1 of everything up the middle, Amh test to see what your egg count is, and a semen analysis. 50% of all issues with unexplained infertility lie with the male. So not only would I advocate, and Amy could support this, a semen analysis to look at the motility of the sperm, the count, the number of sperm, where they're swimming to, and whether they are normal or not. But also, I think the test for the stress test is also becoming increasingly important. Wouldn't you agree with that, Amy?
Yeah, definitely. We're seeing lots of patients coming through for that SOS test that have seemingly normal sperm, but then the oxidative stress test tells us that actually the sperm are stressed, and we can treat it. We have it's easy antioxidants for 2 to 3 months. Sounds like a long time, but then lots of people that stress goes away, and that can make a really big difference.
Yeah, but the other important thing is don't take the treatment if you haven't got the stress. One of the things that men do often, their partners will advise them on taking lots of vitamins and minerals, and actually that can be counterproductive if you don't need them. If you've got a perfectly normal sperm count with minimal stress, giving antioxidants such as vitamin E can actually have a negative effect. Isn't that right, Amy?
Yeah, absolutely. Yeah, it pushes you into something rather than oxidative stress, you go into reductive stress. And when we see those results, often we ask the male patient, "Are you on any antioxidants?" And they say, "Oh yeah, I've been taking all sorts. You know, it's supposed to be good for me." And we go, "No, stop those," and then it normalizes and it's good.
Can I just answer one more question? Because I said this lady suffering from endometriosis, and she's got 2 5-centimeter endometriomas in her ovary, and she was wondering whether she should have these removed because they're causing pressure on that ovary, and that ovary hasn't responded to the hormones. Well, it's a bit too simplistic just to say yes or no, because you have to take other things into account, whether they are symptomatic, whether they're affecting you, and where else is the endometriosis. Generally speaking, we would say that if you have cysts in your ovary that are greater than 5 centimeters, then it's probably beneficial to have them removed. But realistically, but there again, if you're over 38, 39, 40, you've got to weigh up the time in waiting for that operation, the time for recovery, and by the time you've had that operation, you may be 41, 42, and that's counterproductive. Generally speaking, I would say that having cysts removed does not improve your outcome, and we just have to say, well, that's, that ovary is not working as well as the other one, and we'll just go concentrate on the other ovary. But again, it's always important to ask your local doctor, the doctor who's looking after you, for your advice, because everybody's different, and endometriosis affects different people in different ways. So your unique journey has to be managed by your own fertility doctor, and they'll be able to give you that advice.
Yeah, absolutely. Okay, thank you. But will you stay on? So we're going to do a short video. Just to give people 3 or 4 minutes just to think of any last minute questions, anything they want to have answered. I've got 2 that we'll answer in the next session in 3 or 4 minutes. So I'll share this video, have a last think, and see if you've got anything else you'd like to ask.
Okay.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about care pay. our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of a one size fits all, but with care that didn't seem to be the case at all. They took everything into consideration, and they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to care.
Oh, the support at care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success and treatment, we look to our own care family. From our consultants, embryologists, and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
Okay, so we do have a few more questions coming through. It's really hard to keep track of because the team are so good at answering them. And I keep going, I'll ask that one. But I think we've got a couple on one screen for you, Charles. So
shall I? How long do I have to wait for IVF after coming off the pill? I've been on the pill for 18 years. Oh, congratulations, 18 years. Straight away, you don't have to wait any time. Crack on. I'm ovulating, but could I try an ovulation induction agent? That's a hormone that can help you release an egg. Generally speaking, if you're ovulating, an ovulation induction agent will not help you. You either ovulate or you don't. A hormone will not. Hormone treatment will not help you ovulate better. But always again seek advice from your local clinic, because we're all individuals, so we might need some specialist intervention. I have an AMH test November 24th, and this is 6.8, but this was whilst I was on clomiphene. Will the medication have an impact? No, it won't have an impact. Any more there, Amy?
There's been a couple about thyroid. What level should your thyroid be? An IVF clinic in Spain state that also, although the normal range in general medicine is 2 to 4, for fertility, healthy development of an embryo, it should be below 2.
Well, we used to there was a lot of research to suggest that the thyroid level, the thyroid stimulating hormone level, should be below 2, 1.5 to 2, and that improved pregnancy rates. That has not been substantiated, and so we're a little bit more relaxed about that now. However, it is essential that your thyroid function is normal, because we do know that if your thyroid function is not normal, that can have an adverse effect on your fertility. So it's always a good idea at some point to get your thyroid function checked, and as long as it's normal, that's absolutely fine.
Yeah. Are the charges for IVF the same across all your branches? I think that's been answered by the team. Do you check for progesterone and for clotting as causes of miscarriage?
Well, generally we wouldn't check for clotting abnormalities until you've had more than one miscarriage. Although, again, everybody's an individual, so it depends on the circumstances, what the background is, what your history is. That it may be more relevant to do more extensive investigations early in your treatment than later. But again, your local doctor will give you specific advice as to whether you need additional investigations.
I think I've frozen, have I? But I'm still here.
Yeah, I didn't quite get all of that last question, but I sort of extrapolated what you were saying, Amy.
Okay. I've got another one if you can still hear me okay.
But IVF is so expensive. Why not check clotting? Well, it's the reason, again, why we wouldn't routinely check it, because it is extremely unusual to have clotting abnormalities. And if everybody had their clotting checked in the absence of any significant abnormalities in the history, it would add quite a lot of expense to or unnecessary expense for patients. But then again, everybody is an individual, and you can ask that question to your own fertility doctor when you see them. Should I have my clotting tested? Is there anything that makes me a higher risk? And if so, can I have my clotting tested just for my own reassurance? And of course, we can take every case into consideration, but routinely, it's not warranted for everybody.
Okay, last question then. AMH 2.2, 44 years old. Should I really do egg donation after 4 failed IVFs?
I think if you've had 4 failed IVFs and you're 44 and your AMH is 2.8, I think you've done everything you possibly can to achieve a pregnancy with your own eggs. And I really think it's time now for you to consider alternatives. What's right for you and what lengths you want to go to have a family. So I would not rule out the possibility of egg donation at this stage now, because my word, you've certainly been through an awful lot, 4 IVFs within at the age of 44. So yeah, I think it's time to think about opening a new chapter and speak to your clinic about that, because they'll be able to provide you with the information that you need.
I lied. But 2 more questions
Okay.
that have just popped through. So one of them's, do you use embryo glue to avoid an ectopic pregnancy? No, that's not what embryo glue is for. Embryo glue is supposed to help with implantation generally. And then can I talk about the difference between a day 5 transfer versus a day 2 or 3 transfer. So we primarily do day 5 transfers at Care because we want to have that additional information that you get from embryos developing in especially the Care Map system. We can get tons of information about their quality over that 2 days difference, and the lab conditions are so optimized. We believe that whatever the embryo is going to do in the lab, it would have done in you anyway. So we would always vote for more information, keeping the embryos in an optimized environment, and being able to inform you of how the embryo is developing and what the chance of success is. Even if you've got one, we can give you a % chance of having a baby from that embryo if we do a transfer on day 5. And day 5 transfers are largely more successful because of the ability to select embryos better when they get to the day 5 stage. So if you've got a group of 10 embryos, they all look really similar on day 3, but they can all look really, really different by day 5. And that's really helpful for us to be able to select the best one in the group for you. I hope that covers it. I think that's everything. I think that's all the questions.
Well, if there are any more, we can always get back to you via email, or maybe next time we'll have another one of these in the not too distant future.
Yeah.
And before I go, could I just thank the team in Liverpool for their sterling work this week in the face of adversity and sickness. Amanda and Kathy and Ashley have done a great job, and I look forward to seeing you tomorrow in the clinic.
Have.
Yeah,
amazing. All right, thanks, Charles.
Thank you. See you soon. Good night, everybody. Bye.
Bye. So I'm just going to share a final video. We'll leave you with a final few words from us, from the Care team. You've got all of our details. You've got the phone number. You've got the email. You know who to get in touch with if you have any more questions. It's been really great having you all here. Thanks for joining, and hopefully we'll see you soon.
1 in 6 people need help to grow their family. You're not alone. And our Care family will do everything we can to help your dream of family come true. There are over 50,000 Care babies in the world today. And behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are Care.